Thank you, Mr President. Today I rise to address the very concerning issue of the medical centre in Peterborough, which at this stage is set to close its doors on June the 30th, the very end of this particular month that we're in now, due to a shortage of physicians. The Mid-North and many parts of rural South Australia have suffered from a shortage of doctors and health services for some time now, and the closure of this clinic will make an already dire situation much, much worse. Peterborough, of course, is a small rural town, some 250k north of Adelaide. It is home to approximately 1,400 people. When the clinic closes, those people will have to travel to either Orroroo or Jamestown for medical services, which are both approximately an hour round trip. And in fact, many are already doing so due to long waiting periods. This travel is not feasible, however, for quite a few of them. And indeed, if they do not drive or if they cannot afford a taxi fare, in fact, their only option in some cases might be to catch one of the 3 weekly bus services to Port Pirie, some 100 kilometres away. And indeed, locals have already stated that they will simply have to stop going to the doctor, which is not a position anyone in this very wealthy state of ours should be finding themselves in. The proposed short-term solution is to rely on temporary locums to fill this gap until a more permanent solution is reached. However, there is already a shortage of locums in the area, and it's been acknowledged by the Rural Doctors Workforce Agency that there will be difficulty in maintaining this service consistently. I'm informed that there's also an issue regarding the continuance of care, continuity of care. Because when you don't have a permanent doctor, as notes and files are passed from doctor to doctor, and you see a different person each time, there is an increased chance for important facts or observations to be missed. And patients, of course, are already taking it upon themselves to bring their own notes to appointments to ensure that that does not happen. But that is not the best practice for quality of care. The clinic in Peterborough is currently the only one along the Barrier Highway in the 350 k's between Burra and Broken Hill. Not only will the closure of this medical centre make it much harder for locals to access necessary health and medical services, it will of course have an impact on those in the surrounding communities. It will put pressure on other medical services and centres in the Mid-North that are already struggling with being understaffed and having a large backlog of appointments, with some patients already having to wait for months. Across Jamestown, Orroroo, Peterborough and Bullaroo, there are only 3 full-time GPs. That's approximately 1 GP per 3,000 people. Broadly, in rural South Australia, the number is around 1 GP per 1,200 people. For comparison, the federal government's aim is to have 1 GP per 900 people. Indeed, GPs in rural areas commonly work not only in the medical centre but also, of course, in the local hospitals to attend to the inpatient facilities, provide obstetric services or anaesthetics, and there's a lot of responsibility and commitment which those doctors may not be ready to undertake, especially if there is only 1 GP in the clinic. This will, of course, have economic impacts because if people are already having to make the effort to travel to another town for medical services, they're likely to then do their grocery shopping, complete their other errands while they are in that other town to make it worth their while. And that, of course, will have a negative effect upon the local businesses in Peterborough. The state government has, of course, and it is very welcome, established the Rural Health Workforce Strategy, and that has launched various plans and programs such as the Rural Generalist program announced in May 28 of this year. Funding has been allocated to various projects since 2018 with the goal of recruiting, training and developing professionals and volunteers and improving systems and equipment. The Rural Doctors Association of South Australia has voiced various concerns with the Rural Health Workforce Strategy, however, including that it does, quote, does not display a strong commitment to the pathway, only suggesting preparation for the rural generalist pathway, end quote, and indeed have pointed to inadequate funding to implement the multiple strategies and the consultation process, quote, leading to the collection of inaccurate data, end quote. These are all quite concerning. A study of medical professionals that was published in May 2021 from Monash University found that more students spent time in rural areas on placements. The more those students spent in rural areas on their placements, the more likely they were, of course, to accept a job in a rural area once they graduate. Perhaps including more rural placements and better supporting students undertaking them will entice those students to work in rural areas. Another option, of course, is to provide funding to regional universities and TAFEs so they are an accessible local option and students are not forced to move into the metro areas to study in the first place. A key hurdle once students are qualified, of course, is making a permanent GP an attractive option. Currently, locums are often paid at a higher rate than permanent doctors, so the financial incentive for doctors in rural areas is to be a locum that travels around to the different areas rather than a permanent GP remaining in one town. The federal government's recent bulk billing incentive has been welcomed by GPs across Australia, having greater incentives such as this one for doctors, especially young doctors, to become permanent GPs in rural areas, and ensuring that they have the support they need within the clinic is, of course, essential. Mr President, the closure of this clinic at Peterborough will have real, tangible and negative impacts on the locals in that town and the surrounding communities. That is why I draw the attention of the Council to this looming event. Unfortunately, Peterborough, of course, is far from the only rural community in South Australia facing this issue. Further north, in Quorn, the only GP has been unable to find a replacement as that GP prepares to retire, and locals in Hawker and Leigh Creek have their clinics open only a couple of days a week already. Others are waiting up to 3 months for appointments in nearby Port Augusta. This is a crisis, and it's not just a crisis in South Australia. Of course, it is a crisis right across our nation, and we need strong commitments and real action and increased funding to fix it. All South Australians have a right to accessible, adequate and affordable health care, and Peterborough needs a lifeline.